Hello, everyone. Welcome to our next panel, which explores how artificial intelligence helps cities enhance residents' access to social services. Cities can learn more about what their residents need by using data analytics powered by AI, enabling them to tailor their services more precisely to the people who live there. This personalization can increase the efficiency of service delivery and ensure that resources go to the people who need them the most. AI can also streamline administrative processes and cut down on bureaucratic hurdles. So we're going to explore in this session how AI is already being used to support residents in three very different contexts. First, at a hospital in Singapore, and then two views from the US, in California and in Boston. For this discussion, we're joined by Dr. Hairil Rizal, Senior Anesthesiologist and Clinical Director of Value-Based Healthcare at Singapore General Hospital, Jenn Thom, Director of Experience Insights at Code for America, Jamie VanDodick, Director, AI Ethics and Governance at IBM, and finally, joining us virtually is Santiago Garces, Chief Information Officer for the City of Boston. Dr. Rizal, let's start with you. So you developed a system that currently is being used at Singapore General Hospital to improve surgical outcomes. Tell us a bit about your software that, if I understand correctly, does two things. It can look at a halo of risk factors for a patient who's already had surgery and gauge whether that person is sick enough to need a bed in the intensive care unit. And it can also look at risk factors for a candidate for surgery and weigh the likelihood of complications post-surgery so that patient can make a decision about whether they want to go through with the operation. So how did you create this tool and why?
So firstly, thank you for having me here. Great question. So I am a practicing anesthesiologist, so I double with surgical risk all the time. We have to decide which patients are sick enough to be sent to ICU. But in the traditional, the non-AI method, it's more of eyeballing, right? It's based on your experience, based on your subjective measures, and you decide, hey, this patient might need ICU after the surgery. Now, the problem with that is that operating theaters and ICUs are the two most expensive resources in any major hospital, right? Be it in terms of monetary financial resource as well as skill set resource, right? And a lot of us tend to be a bit more careful at times about our patients, so we tend to overuse that resource. And this is just not sustainable in the long term. And coincidentally, my PhD is actually in large data and data science in healthcare. So it's just natural to marry the two. And as a result, Singapore General Hospital has just deployed this machine learning-based model, as you mentioned, that's able to give a personalized likelihood of patients developing complications, major complications after surgery, such as death, heart attack, stroke, and whatnot, as well as that likelihood of requiring the ICU care after surgery. And we've done this nearly a year ago, and we found that we learned a lot of things along the way. Firstly, is that you need a model that is based on local data. And I know there's quite a number of models out there doing this similar things with regards to predicting risks and surgery and whatnot. But it is very difficult to have a personalized, accurate prediction to your patient if you are using data from other hospitals, right? So that's what we did. We used, I think, about 170,000 patients from Singapore General Hospital. And we had about 600 variables to pick from. So it's a huge data set. We ran the machine learning model to come up with the outcome measures. So that's one. You need a local data. And then next one, with that model, we make sure that it's an explainable model. Because in healthcare, especially when you're dealing with clinicians and the buy-in will not be there if they can't understand what is happening, right? So one of the key criteria back then is that it cannot be a black box model. So it must be something that's explainable, can be understood by even the most, senior clinicians who have no clue what machine learning or AI means and these kind of things, right? So we had to make sure that that is there.
And I'm assuming you want patients to be able to understand as well, because this is going to be a conversation they have with their doctor.
Yes, definitely.
How have patients been reacting in the time it's been in place?
Great question again. So I must say that it's a mixed reaction. So there are some patients who are very open to it, excited. When you hear, oh, it's an AI, AI giving you this risk prediction, right? So, oh, wow, it's a new thing. And we have those who are very skeptical, and there's a clear age difference in those two groups. The younger ones would just take it like a natural thing, whereas we have the more aged patients who are very skeptical about it, right? And not just the patients. It's the same with the clinicians. The younger clinicians just take it on like nothing. It's like normal day-to-day, part of the decision making. Yeah. Whereas the more senior ones will be asking, why do I need this, right? And if this model tells me something that I don't agree with, then how, right? Or if I were to make decision using whatever that this model tells me to do, who's liable if there's anything wrong, right? If I think this patient has a high risk of developing complications, whereas the model says is not, and then something happened, and who's and I get sued, who's paying, me or the the developer, right?
That's a completely understandable, nerve-wracking thing.
Exactly.
I wanted to, you mentioned like the 600 different variables that you have going into the system. And there's kind of a famous truism in data analysis, garbage in, garbage out.
Definitely.
So when you have so many factors that have to go in, and the stakes are literally life and death, what are the obstacles to good data collection in a hospital setting, and how are you addressing them?
Yeah, healthcare data is well known to be extremely dirty in terms of the need for data engineering. We spent a couple of years just cleaning data to make sure that the data is inclusive. All right, and that's a very, very important point because, as we've heard in multiple talks previously, bias of the model is a real thing, right? We must make sure that the definition that is used by every clinician are the same, because most clinicians, they do not like to use structured data. They don't like to click on the check boxes in your EMR, your medical records, right? They like to type. So that's a lot of natural language processing needed to derive what the clinician means to the correct label, right? So I must say 70% of the effort was actually in data cleaning and data engineering. It's not easy. And if anyone want to invest in terms of developing these models in hospitals, this is where I think the area of need is. We generally have more data scientists and data analysts than data engineers, unfortunately, right? Mm-hmm. We need good quality data first for the data scientists to work on. But if you don't have a good data engineering team, that's where you get your garbage in, garbage out.
Lastly, I wanted to ask about what privacy concerns exist. It's healthcare.
Okay, privacy concerns is definitely a huge thing, and it's really a double-edged sword, right? It's good. You definitely need a high level of privacy, especially when you're dealing with healthcare data, right? In the US, you have the HIPAA Act and so on to govern similarly in Singapore. But at the same time, it does make our job slightly more difficult because you want a personalized type of care. You want a personalized medicine, right? You want and some of this data can be very personal, right? So having a good regulation, you have a good data infrastructure, data security infrastructure is extremely important in developing these models, definitely. And I would say that there are more things to be done, and there are more things that we could do, right? If we have good regulations in place to allow us to use more data. Um, most of the clinical outcomes for the patient, the health of anyone, right, is only 20% of that the health status for anyone is actually determined by clinical care, by what your doctors prescribe to you, by your and whatnot. The other 80% is actually due to social determinants of health. And these data on social determinants of health, your access to good quality education, your food and nutrition, your economic, stable economic status and whatnot, this data does not flow into the hospital EMR. So we're not able to have a good holistic view of that patient whenever we want to define risk for this patient.
Interesting. Thank you very much. For our second case study, we turn to Code for America. Code for America is a nonprofit that works with cities across the U.S. to help them connect residents to services like food assistance or healthcare. Ms. Thom, could you describe a bit what your organization does in its partnerships with cities?
Sure. Code for America works with actually state governments to apply the tools of technology and service design to help advance our mission of alleviating poverty and advancing equity. And so we do that through a few different portfolio areas, one being tax benefits, where we connect people with the tax credits that they are eligible for. We also do automatic records clearance through our criminal justice program. We also work on a local initiatives program where we think about place-based solutions for systems change. And my colleague, Hashima Tuzi, who's here also at this conference, is the lead of that program. But today I wanted to talk about the safety net portfolio, which is our largest portfolio, where we're working, as I said, with states to help people stand up human-centered systems for delivering food benefits, health benefits, and childcare benefits. And in fact, we're working with the state of Illinois to be able to stand up a paper-based application for childcare to an online service, which is really exciting. But today I really wanted to talk about our Get CalFresh product, which is deployed in the state of California to help Californians get CalFresh benefits, which is food benefits. And so this is a really accessible application. It's mobile friendly. It is at a third grade level reading level. So it's very plain language, very clear. And it's also in multiple languages as well. So it's in English, Spanish, Chinese, with support for Vietnamese as well. During the pandemic, we saw that many people were, of course, applying for food benefits. And we have a very active and caring client success staff that found themselves underwater during this time. And so one of the things that we were thinking about was, how can we help our staff be able to handle all of these requests coming in for people who are applying for benefits? So in the spring of 2022, we worked with a partner, Cisco, to be able to deploy a chatbot that was pretty simple at the time, very rules-based, where it was meant to auto-close, right? So basically trying to figure out what the kind of lowest hanging fruit, what the simplest types of cases were, to be able to kind of close conversations to allow our client success staff to be able to really focus on the most complex cases, right? So being able to focus on the cases that needed the most human kind of touch. And so, we've had that pilot going for a while, and in spring of 2023, we decided to experiment with a large language model to kind of improve the performance of this chatbot. And so we deployed Bloom, which is a large open source large language model that helped us to, I think, classify more or identify more messages that might be able to be auto-closed. And we were able to use this large language model to expand our chatbot from English and Spanish to Chinese And we were able to kind of expand coverage of the chatbot as well. So when we were using this rule-based type of approach, we had about 7.1 of the exchanges handled by the bot. And after we used a large language model, we were able to get that up to 33%. And this chatbot to date has handled about more than 35,000 messages. So we've been excited about the possibility of using this type of technology. At the same time, we have put in a lot of safeguards in place to be able to make sure that we are applying this technology in the right way. So we have, as I said, a client success staff that is really sort of looking at all of the actions handled by the bot to make sure that the bot's doing the right thing. We're always evaluating. We have dashboards, which I think are very popular with many folks in this audience, to be able to make sure that the bot is handling what it should handle.
I am curious to know more about that because as someone who's interactions with a customer service bot have ranged from the useless to the enraging.
Yeah.
How do you make sure that that is not the experience of people who are applying for food stamps in California?
Yeah, so I mean, we always have a fallback, right? And we make it very, very easy for you to reach a client success staff, right? So there's not this shouting into the phone. It is a chatbot, so it's not something that is on the phone, but it is something that we really offer a very, very easy out so that you can have a live chat conversation with someone.
Okay. And what are some of the challenges that you face, like, in partnering on this work? You're so much is at the federal level, I believe, in your...
Yeah, so I think one of the interesting things about this CalFresh application is that it's actually something that we work in partnership with California on, but this is actually a service that we maintain. We are in the process of working with California to help them sort of move towards a sort of single place to apply for benefits. But in the meantime, we are using this Get CalFresh product to be able to learn about different technologies and different innovations that the state of California can use as they start taking on more of this work themselves.
Thank you. Now let's head from California across the country to Boston. Thank you, Mr. Garces, for joining us virtually. You're Boston's Chief Information Officer, and earlier this year, you encouraged city employees to use AI to, do some of their work, from writing emails to memos to generating images or video. So tell us a little bit about why you wanted to do this.
Thank you again for having me remotely. I apologize I cannot be there in person. But again, the city of Boston has been using kind of what we think about this previous generation of machine learning and artificial intelligence to build models to extract information about assets in the right of way and to identify locations that are at a higher risk of issues in order to prioritize inspection for our inspectional services department. But in the past year, almost a year ago, OpenAI released the first version of ChatGPT to the public. And I think that it is particularly these new types of technologies that we know as generative AI that leverage these massive amounts of data about language, about images, to be able to generate new content that really started to capture our attention, both because of the opportunities and the risks, and because of how pervasive these models started to seem. So, and in some sense, like what we started to see is that when you have technology that is able to allow you to process language, and not language without very little barriers to entry. You don't have to be an expert coder to interact with these models. All you have to do is be able to talk to it in the way that you talk to anyone else. And you're able to do things that, and as the models evolve, increasingly more sophisticated things with very little training and very little context up front. And in an organization like the City of Boston, where so much of our work, we spend a lot of energy dealing with each other, writing things and reading things, these models have a great opportunity of reducing burden and time that we spend doing things in the good old bureaucracy, and instead shift our attention to be able to focus more on our constituents and on our workforce. So a few examples. In our department, we still have a vacancy rate of over 20%. So staffing and modernizing the way that we staff the department is really important to us. We've been using some of these tools to be able to write job descriptions and to be able to build skills and competency matrices for new lines of work that the city has not had in the past, including product managers and other things. And again, we think that these tools, when used under the supervision of people with their expertise, with their agency, with their responsibility and their to the public and to the city, that they can be incredibly powerful. So that's why in May we released these guidelines on the use of generative AI, and we tried to focus on three guidelines. The first one, again, making sure that people understood that it is their responsibility to verify the output of what was being generated, that they were responsible for fact checking, that some of these models can hallucinate, can make up information that looks like it's true, but it's not true. The outputs can be biased and racism, genderism, and all these things are so subtle, and they can change based on context and based on language itself, what language you're getting input. So again, making sure that people were aware that they had a responsibility there. The second guideline was making sure that people were disclosing the use of these tools. And the third guideline, not using any sensitive or confidential information. So we wanted to enable all of our workforce to be able to experiment and learn how the tools could be used, both to better understand the risk, the opportunities, but most of the tools that people were going to be accessing were free and not enterprise-grade applications where the information was going to be shared back with the provider. So,
do you have a sense? Do you have a sense at this point, like what share of your employees have taken you up on the challenge?
So, I need to review my my data, but at the time, early on, we started noticing probably around 100 to 200 people participating in some of the earlier trainings, and most of them had said that they had used the tool at some point. We're starting to see now, as the tools get better and maybe time goes by and more people get interested, there's kind of a second wave, if you will. I would estimate that there's somewhere around like 50 to 100 people that use the tool consistently. I think for a lot of people, they use it, they either are impressed or feel skeptical, and then they forget about it. I think that there's a small percentage of people that are using it consistently. Actually, the number of people that submitted concerns were really few. There's less than 10 people that submitted concerns, and I was expecting more people to be sharing. We created a forum for people to submit concerns. Mostly, they just wanted more training material and more training opportunities.
And so people are using this to write job descriptions. And is there anything that's more resident-focused, Boston resident-focused, or is that like more in the future?
Oh, absolutely. So again, I focus on that initial piece just because I think that anything that makes our government and our bureaucracies more efficient, they're less appealing and interesting, but I think that it's so impactful. Like, think about the impact of the spreadsheet on government. Like, it revolutionized the way that we can run, how we budget, how we create programs. But we've been also starting to use a lot of these tools for data analysis around our constituent services using open data, so things that were already in the public domain. I've been using it to look at regulation and try to look at our procurement regulation that the state sets for us, and be able to understand and create process maps around what are the steps that we need to take in order to do different types of procurement. And obviously, I then go and verify it with our lawyers. I have a lot of people that make sure that we don't make mistakes. In government, usually you have a lot of checks and balances. But I'll give you an example with some of the advanced data analysis. We're able to start looking at whether there's statistically difference in depending on neighborhood, the response rate to potholes, or statistically differences in the incidence of rodent infestation. And again, a lot of times in government, we have data that has been created by humans that's a little bit messy, and we type things a little bit differently. This is also where large language models that are intrinsically built with language that embeddings that are able to take words in different contexts and try to understand their meaning are incredibly powerful to analyze government data. And so we've been doing a lot of these things, but again, always with a human in the middle and intermediating the results at this point. We've been, some of our team starting to look at the research of how we would be able to enable applications that are, that don't have this type of control. But our concern is, until we have better understanding of the quality management and making sure that we're able to detect bias consistently, that we're able to assert accuracy consistently, that those type of applications are a little bit 2 steps ahead. Whenever we figure out the answer to that, we'll venture there.
Just last thing, you've been collaborating with some outside partners. Can you tell us just a little bit more about that, who they are and why you chose them?
Absolutely. So when we started building the guidelines, we engage in really good dialogue with a lot of our employees. There's people that, again, both people that were very excited about this and people that are fairly skeptical. With academics, and in Boston, we're very lucky to have almost a major university in every neighborhood. So there's a lot of academics that have a lot of expertise to help us think through these things. And we've been working with a lot of people in Northeastern University as well, which is one of our local universities. There's been a keen sense, again, of the opportunity of engaging with civil society in the absence of government, to use these types of tools to really enable community members to get access to an understanding of how their government works. So Dan O'Brien, who's a researcher at Northeastern University, and some others, in partnership with a community-based organization called Tech Goes Home, are doing training with high school students on these tools and helping them understand how their government works, so they can be discerning and challenge the way that we do business.
Well, that's good to hear. So thank you very much. And lastly, we have someone here who has spent a great deal of time thinking about how to train new stakeholders to ethically deploy AI and machine learning technology. Jamie VanDodick is the Director of AI and Ethics and Governance at IBM. And I just wanted to ask, how would you recommend that cities begin accessing the benefits of AI, and what is the concrete way to start actually to doing that?
Thank you for asking. I think we've heard a lot around how to convene our stakeholders. The cities are the residents. It's the users, it's the providers, it's the officials, it's the funders, right, who have to come together to see the promise of AI, the benefits and the risks. So I think probably part one is the raising of the awareness and the education for adoption. This also comes obviously from the workforce, like you're already doing. There's a recent study that IBM did. We have our business value study where it said 4 of 5 executives that participated in the study said that generative AI will augment or change how employees' roles and skills are from today. So that's a pretty big task in front of us. I think what we've done at IBM is both, as we just talked about, we've done training. So we have IBM Skills Build. Mm-hmm. Anyone can access it. And essentially, Skills Build, we've already committed to train 30 million folks through 2030. And then to address the AI challenge, we're going to train additional 2 million folks, primarily in underserved communities, really to take advantage, and we heard earlier today, right, to help build the divide, but also the need and the demand. We do this with partners to help us scale because it's a big task ahead of us. And we're also partnering with academia, like we just heard. We've had a long relationship with MIT. And from an ethics standpoint, your neighboring state, we've partnered with IBM. There's the IBM Notre Dame Tech Ethics Lab, and there's calls for proposal. We've already done one in ethics and done one in AI auditing, and you can go there and see the next calls for proposal, and they're open. So if communities want to get involved that way, they're welcome to. We've also done a lot with Chicago and with Illinois, maybe folks are familiar with. There's the Discovery Accelerator Institute. This is a partnership between IBM, the University of Chicago at Urbana-Champaign, and the state of Illinois, really hoping to upskill folks in the community and work on research. So breaking areas in AI, in quantum, in cloud, and those collaborations, whatever comes from them, right, can be out for the community's benefit.
When you say upskill, do you mean, is it a case of sort of encouraging people whose primary job is not related to AI to use the tools, or are you talking to like actually training people to be able to be data engineers who can eventually work on like hospital dirty data?
I think it's a combination. So I think for folks that have no familiarity with technology who are coming in, if you go to Skills Build, there's place for K through 12, as we heard for earlier today. There's for educators. How do I bring in some technology into my classroom? And also for partnerships. We just heard, like, the barrier for entry in the Gen AI space is low, but still familiarity with technology, how you use it, how to put in guardrails, and then all the way up through with universities around the data scientists, now the prompt engineering, the data engineer, all of those kinds of skills. So both sides, I think there is a continuum that we're working towards, right? Depending on where you are in society, the kind of work you want to do, and really to leverage this partnership between academia, industry, the nonprofits, and governments to come together.
Now I think we are going to turn to questions from the audience. Does anyone have burning questions, or do you need a few minutes to assemble your thoughts? Microphone's right over there. Okay. Well, we wait for people to, take a minute to figure out what they want to ask.
I actually have a question.
We will have one of our panelists kick it off.
I'm very interested in the ethics of AI. I mean, coming from healthcare, it's a big minefield, right, in that area. So one of the questions I got asked a couple of days ago is this, right? Do patients have they do have the right to know that, their care is partly done, or, they have some input from the AI machine, but is it an ethical obligation of the clinicians at the outset, right, before meeting that patient, right, as the patient comes in and say, hey, by the way, I'll be using some AI decision support to treat you? Is that standard that we adhere to, or do we only, say this if the patient specifically asks for it?
So I'm not going to speak I'll speak for myself, and I'll speak how IBM is managing. So for responsible data management, it should start with the principles, like whatever the principles of the hospital are. IBM has principles of trust and transparency. And the first one is to augment, not replace human intelligence. And notice is an important part of that work. Mm-hmm. So as you're interacting with AI, it's important that you want to know that, am I making the decision, or is AI making the decision? So I don't have the regulatory decide from that, but I definitely think that is important. And also that anyone who maybe comes into the hospital knows what those principles are, right? How is the hospital, how are the doctors managing, how are the clinicians managing? And there's a standard of care that is the doctor's standard of care. Ethics is an umbrella that, right, beyond regulation, I think everyone in the audience will say, we're going to act from a compliance standpoint. We're going to do what is required of us. And ethics says, this is what my values are, my principles are for the hospital or the agency. So I'm going to say a yes for that.
So if you're a patient, you expect your doctor to mention at the outset, before you even have your whatever diagnosis and whatnot, the doctor to tell you that, hey, this is based on some AI
I'm
model.
assuming in the continuum, I'm assuming soon that will become standard, right? As you interact with folks, any kind of chatbot where normally it would have been a human and now AI, I think it's going to become standard that there's going to be a notice to say you are now interacting with AI. Should you need to contact a human, here's how to do it.
Should you need to contact a human, here's how you do it. Brave new world. I'm sort of curious too, and I wanted to build on what you were saying. But when you're talking about notice and privacy and all of these things, you're collecting so much sensitive information in so many of these scenarios. So how do municipalities or organizations, what is the ethical, how do you manage that data responsibly, specifically when it comes to AI?
I'll go from a responsible data management. It's really a program, right? It's broader than just privacy concerns or security concerns. There's a great paper that's out from the Data and Trust Alliance. It's called The Urgency of AI Governance, and it has the 3 tenets. And it starts with the understanding what the foundation is for your AI. So that's basically saying, what's my risk tolerance? What programs do I already have in place? What are my principles? What are my practices? The second is to document your ethics, to really understand what are those guardrails that we as a company, we as a city, we as a corporation, we believe in. And then the third is to build on the foundation that you already are doing, right? There's already a set of governance or set of compliance that's embedded in how you operate, whether you're a city, whether you're a town, whether you're a corporation. And so AI it's new for folks that have never used it, but the tenets are the same. And so you can build upon what you have because I think often folks are like, well, how do I even get started? And you're already doing a lot of the things. It's just that maybe now you need to augment, to be thinking about the new applications or new use cases that might come in. And how do I incorporate that back? And also that making my employees or my constituencies aware of what those are.
And if I could add to that, I mean, I come from really a human-centered design perspective, and I think also really understanding sort of your end user and sort of what they might want beyond sort of compliance, right? Like really understanding what their fears, their values, and their expectations are. And I think talking to people and, doing more user research to try to figure out sort of what those requirements are that make something a good experience, I think is another layer that needs to be in place beyond, I think, in addition to, I think, a lot of the more regulatory and more compliance-focused things as well.
Can I build on that?
Yeah.
For folks that say, I don't know how to do that, if you look up design thinking, there's exercises that you bring community, whatever the community is for you, together to do those kinds of exercises around empathy mapping. What are the folks thinking about, feeling, understanding? Because often for folks that are not UX designer, it's where do I start? How do I know what my stakeholders are feeling? And so it's a good tool for folks to use to help them get started. It's a good point.
I see a couple of people standing at the mic, so yield the floor.
Hi, my name is Christine. I'm the former Chief Data Officer for the City of San Jose. I really appreciate this conversation around ethics and creating guardrails for ethics, but I also am cognizant that each of you are responsible for service delivery, right? And technology is an opportunity to fix some of the inefficiencies in your programs. So I'm curious to hear from each of you on how you make the trade-offs between, guardrailing for ethics, right? But also, guardrailing for failure, which is an inevitable part of innovation, right? How do you make the trade-off between efficiency, moving fast, and ethics?
Can I take a stab at that? Sorry. The awkwardness of the hybrid participation. But Christina, I'd say in Boston, the way that we've been approaching about not only with AI and to the previous conversation, we think that emerging technology and all technology should be thought about holistically from a security perspective and from a data management perspective. And we think that foremost, we need to start with thinking about the benefits, like what is the problem that we're trying to solve and how is it articulated in terms of the user? Like what is the value to the constituent? Because that helps us understand if the costs and the risks are worth enough introducing new technology to try to address that issue. So if the potential benefit of an intervention is not large enough, maybe it's not worth complicating and investing in a large, complicated system and exposing people to increased privacy risk and securing more stuff, and then investing in the technology. So I think that it's a calculation, but for us, it always starts with the value articulated for the constituent and being able to disclose it. And our director of governance and policy for our department, who just started, I know is in the audience as well. So that's again part of this like holistic approach to managing technology governance.
I think you had a point you wanted to make.
Yeah, so Code for America is really at the early stages in learning how to integrate some of these new sort of AI-focused technologies into our work. And one of the things that we have been talking about is thinking about sort of what are our interaction principles? How will we really explore and learn using these technologies? And we've really focused on sort of three main things, right? So one, really, I think, aligning with our existing data ethics practices, which are pretty robust already. So thinking about how we secure our data, making sure that only the people who really need to have access to the data have access to them, having it stored securely. The second principle that we're really focusing on is always having a person in the loop. And I think we've heard this numerous times over the past 2 days, right? There's always someone who needs to be able to make sure that whatever you're implementing is doing the right thing. And if it's not, being able to like take that information and course correct. And the third thing that I think is speaks a little bit, I think, about the trade-offs is one of the things that we have been focusing on is this idea that we would use these types of new technologies more for reducing administrative burden, right? So filling out forms, can we help people sort of take less time to fill out forms, make it easier? Can we use AI to help with that? Can we help people who speak another language be able to access a benefit that they might not have been able to do very easily before? And so using AI for that type of service delivery is something I think that we are trying to explore in order to I think, not wander into territory that might be, a little riskier.
Thank you for the opportunity. My name is Sadman, and I'm a policy analyst working with the UN Development Program. And I just recently started working on a project for AI implementation in Bangladesh with the government. And we're in this very early brainstorming phase where we're thinking of partnerships. And university partnerships really came up a lot today and totally makes sense for the research capacity. You need the private sector for manufacturing and innovation. How do you see civil society fitting into all of this? I was in a meeting last week. We had an academic, we had someone who worked at Amazon, we had government people, but no one from civil society, and I couldn't picture like who could be from civil society in this. So I want to hear your thoughts. Thanks.
Well, I'll give at least one example. The Partnership on AI is a convening body that does exactly that, and they lean in very heavily with civil society. Mostly, they bring in agencies which represent civil society groups. And PAI, if you go on their website, Partnership on AI, they also have a set of initiatives that civil society has already weighed in. So they just came out with a set of safety protocols. And so if you look at who has contributed, you'll see that it weighs heavily for civil society. And maybe one other point, I think community organizations and activist groups are really also a great place. This is not my IBM hat, but I know in my hometown, community organizers are helping to say, how are we bridging, we heard about this earlier today, like bridging the digital divide so that folks that in our neighborhoods that are underserved can have a seat at the table of what government is doing, and also even what classes are offered at our local community college.
Thank you. And last question, I think.
Hello, my name is Jose Antonio Andiviela. I work for Microsoft Western Europe Cities and Regions. And my question is especially regarding social services and not only healthcare. I think one of our toughest problems in all of our cities is people aging. How do you see the application of artificial intelligence, especially generative AI, to improve the engagement with those people, especially elderly people that are living alone, mainly to avoid the undesired loneliness?
Yeah, I mean, aging society is a global problem, really, and I think it's one of our main thrusts in Singapore as well. And a lot of efforts are, given to address this problem. And I think bridging that digital divide, as you were saying, among the generation, it's really a tough effort. And having them, again, to your point, I fully agree that we must find a way to help with this loneliness syndrome, right? A lot of our aging patients, especially in global cities, Singapore, Tokyo, I'm sure, and Chicago and New York as well, you have aged persons who suddenly out of retirement and suddenly find there's lesser and smaller and smaller social circle, right? And how then we can use AI to help them in not feeling that lonely, right? Which is extremely important at that later stage of life. One of the dangers is, as what we were saying just now, is in terms of hallucinations and whatnot with generative AI, large language model, right? So if I'm an elderly person and I really have nobody to talk to and want to ask somebody, maybe something about healthcare and things like that, it must be accurate. There must be a guardrail against hallucinations. So how do we do that? And I think there are a few techniques out there. For example, we can actually make them, we can actually educate them on prompt engineering a little bit. Just a personal example, it is now my habit. Whenever I use ChatGPT, the last sentence would be, if you don't know, just say no, right? And do not make up for facts. It's a habit. Every prompt that I do, I will add those two sentences at the end. It has changed the answer completely, right? So that's one of the tips, all right? And secondly, prompt engineering, there's also fine-tuning, make sure that the answers that come up from these LLMs are something that is easily digested by the elderly persons, right? So it doesn't give you long answers with jargons. For example, you actually train them to give nice answers which are easily understandable by our elderly persons. And thirdly is something that is quite in fashion nowadays is to use retrieval augmented generative. For example, in my hospital, what we are doing right now is that we are training ChatGPTs or large language models to retrieve, to provide context based on our clinical guidelines, so that it doesn't go and troll around some dark end. It is actually focused on a ground truth, right? So that would help to reduce or eliminate hallucinations. And I think this is something that we need to get more people to be aware of. There's some techniques that we can do to de-risk using chatbots like that, especially for those who are at risk, like our elderly patients, for example.
I think that we have to cut things off. So this will bring to an end our discussion of how cities can use AI to help deliver social services. Please join me in thanking our panel.